not everyone with diabetes ends up in a kidney disease. So who are those people, those unfortunate kindreds who end up having a kidney disease in diabetes? Diabetes can be seen in young patients, in older age group, but the most prevalent age group who faces the diabetes is them who have been carrying the disease, who have been living with the disease for the longest period. That is, after 10 to 15 years, a patient who has uncontrolled diabetes, the chances of developing kidney disease increases. More so in people with metabolic syndrome. That is, people who have gained enormous amount of weight, who has gained central obesity, abdominal fat, who have had fatty liver, high cholesterol, hypertension. They are the people who faces most complications with diabetic kidney disease. So the causes, if we can see, is not only diabetes, there are also these hypertensions, hyperuricemia, hypercholesterolemia. They all act together, holding their hands to damage the kidney in case of diabetic kidney disease. Diet is the most important treatment of diabetic kidney disease, because the diabetes needs to be under control for diabetic kidney disease to be treated, and for that we need to take less amount of calorie in our food, more amount of fibers in our diet, like vegetable fibers in form of fruits, vegetables, and less amount of fat, which causes atherosclerosis. That is, it causes the damage of our blood vessels in the form of animal fat, food filled with fried food, filled with oils and bad cholesterol. All these things needs to be consumed less and needs to be taken care of in the form of less amount of outside food, outside snack, less amount of fried food, or less amount of high calorie food for diabetes patients. Diabetes is a disease with which people need to live forever, and diabetes, once it gets diagnosed, it's become a part of your life. So it's better to take wholesome approach, and it's better to embrace the disease than to think that I'm gonna get cured of it. Those people who do regular exercises, eat healthy meal, take their medications on time, go to their doctors for checkup, gets their diabetes under control. As they embrace the disease, they take the fact clearly that this disease is gonna be a part of me. So I better take control of the disease and I better keep my body healthy. So diabetes never goes away completely. Diabetes always remains as a problem of your health. So is diabetic kidney disease, problem which is secondary to diabetes. So it's better to embrace the complication, and it's better to embrace a healthy lifestyle so that we can take control over the disease process. Those people with uncontrolled diabetes who never take their medications on time, who forget to take their medications, who deny insulin, or who are not that careful with their food, sometimes end up having the most dreaded complications from diabetes. That can be in form of diabetic kidney disease, that can be in the form of kidney infection like urinary tract infection or pyelonephritis, which is the infection of the kidneys. Altogether, all these complications causes the damage of the kidney, which is most of the time permanent, and causes end-stage renal disease. These patients are most of the time very difficult to treat. They sometimes become the most problem of the society, as the doctors, the family members, and the people surrounding them suffers the most. These people require utmost care, and they need to learn the fact that they need to take care of their body, as the diabetic kidney disease is going to stay with them. So controlling the diabetes is gonna help them a lot from recovering the disease. Today in this whole discussion, I have discussed about diabetes and the diabetic kidney disease, and this week we pledge to take care of our kidneys for diabetes, as diabetic kidney disease is gonna stay here. Diabetic kidney disease is going to be the most prevalent disease of all, and diabetic kidney disease requires more attention than it has received in the last few years. Thank you.